I mean, you're not a psychiatrist, but still, I would like to know from you. So, Dr. Vatsala, exactly how we have medicines for, fever, like paracetamol, and also we have medicines for stomach ache, headache. So, whenever we go through these pains, we directly go to a chemist. Rather than going to a doctor, we go to the chemist, we buy those medicines, and we take them. So, do we have any, medicine in particular for mental health if we are going through anxiety, depression, or something like that?
Well, we do have medications for these issues, but see, as I said earlier, this mental health is a very delicate issue here, because if you just start popping in medicines, it will not help you. But if you take medication on a prescription by a professional who has studied, who has been trained in the kind of psychological disorders which are there, and has diagnosed you in a specific manner, maybe if you have depression, he will give you antidepressants. If you have anxiety, again, they use similar kind of medication. So herein, the professional, the psychiatrist, is the best person who should be giving you medication. I will say it again that do not take over-the-counter drugs. You have to have a prescription for that. It's very important. And as far as stress is concerned, stress generally is not a mental disorder. It's basically a reaction to situations. So it causes a lot of anxiety. A lot of anxiety is there. Anxiety is caused because of fear. You don't know what is there in the future. When an individual, or humans basically, if you see, when they do not have control over certain things, they become anxious because there is fear of the unknown, basically. So that leads to a lot of stress. So herein, to cool you down, to calm you down, you are given medication, but you will never, you should never be taking medication by yourself. None of them, till the time the doctor doesn't prescribe. It's very important.
Great. So, doctor, I mean, you have spoken about, not to take self-medication until and unless the doctor prescribes you. So now I also would like to know from you if you can, briefly explain what exactly is psychotherapy. People, when they deal with mental health issues and when they go through mental illness, they go for psychotherapy. Right. So what exactly is psychotherapy, if you can please explain that?
Well, psychotherapy, it's also known as talk therapy. It is a process wherein, trained professional helps the individual deal with his emotional issues or mental distress, so that he can cope with that in a specific manner. So we use basically specific techniques where the individual is helped so that he can live a fulfilled life, and it ensures his mental wellness, and he's able to, heal. That is very important. So as I told you earlier also, like in therapy, the therapist generally deals with the underlying issues. For example, one form of therapy is psychodynamic therapy, which stresses on childhood experiences. For example, a child has gone through abuse. He's been abused, maybe a parental abuse or other sexual abuse, anything. So that does impact a child's behavior and his emotional state. So it can be seen when the individual grows up, as he grows up. So here the therapist goes back, does that work with that patient, and tries to get him out of that scenario so that he can live his life, accepting what has happened, because definitely he's not to be blamed. A child who has been abused, not to be blamed. He's not the culprit, right? So here he makes him accept that, yes, it was wrong, but you are not wrong. It's not your fault. So when the individual gets to know that, he understands the fact, he's able to move on in life. It becomes much more easier for him to, I'll say, adjust to situations in a better manner and experience good mental health. That is. And psychotherapy, there are various types. So basically, we have behavioral therapy, we have cognitive therapy. This is CBT, one form of cognitive therapy, RABT, dialectical behavioral therapy. These are the therapies which we are using. Psychoanalysis, also another form, which is also based basically on the psychodynamic. It's a more advanced kind of therapy. Then we have humanistic, wherein it is basically client-centered, and today's world, people mostly are using that, which is, basically meant wherein the client is more in charge, So the therapist provides unconditional support to the individual. So it helps the individual, take his own decisions. Mostly what happens is when the patient comes to a therapist, he comes with the fact that, okay, as you go to a doctor ke paas ja rahe and medication is given and, I'm cured. So he's going to take the lead. But with therapists, it's not that. In psychotherapy, the therapist provides the individual with various options, basically. Okay, you have a choice here, or encourages the individual to come out with options he is comfortable with and helps him decide. So he's not leading him, he's just assisting. So that is, which is more prevalent now, because everybody wants to do what they want to do. They want to feel comfortable when they are with the therapist, when they are taking therapy. So that comfort level comes when the client knows that he is in charge. Because any one of us would feel uncomfortable when we know, okay, the other person is taking charge. So herein, the individual, when he feels that he is in charge, he responds better.